Good afternoon and welcome to today's webinar on vaccination as a condition of deployment operational guidance. My name is Claire Armstrong and I'm the Director of Adult Social Care Delivery and COVID Response at the Department of Health and Social Care. The aim of today's webinar is to provide information and answer questions on the requirement for anyone working or deployed in a care home to be fully vaccinated against COVID-19 from the 11th of November 2021. So the way we will be handling today's webinar will be splitting it in two parts. First, we will be hearing from a few speakers, then we will open up to a question and answer session. So today's speakers in succession will include Martin Teff from the Department of Health and Social Care. Martin is the head of COVID-19 vaccination as a condition of deployment policy. And Martin will give us a high-level summary of the operational guidance. Then we will have Alison Murray from the Care Quality Commission. Alison is the head of Adult Social Care Inspection, and she will cover for us CQC's approach for enforcement. And the last speaker will be Jim Thomas from Skills for Care. He's the head of Workforce Capacity and Transformation, and he will go through Skills for Care one-stop webpage that they have produced. I would also like to mention that we will also have Eamon O'More joining us for the Q&A session. Eamon is Public Health England's COVID response SRO for adult social care. You will see him when the question and answer session starts. So with no further ado, I will hand over to Martin for a brief summary of the operational guidance.
Thank you very much, Claire. And so what I'm going to cover is the operational guidance, but before that, I'm just going to do a very quick summary of what the change to the law is and some key dates for people's diaries. So from the 11th of November, it becomes law that anyone who's entering a care home must either have a complete course of an authorised COVID-19 vaccination or have a certified exemption from vaccination. And so you would need to either have your evidence of vaccination or exemption unless you are a resident in the care home, unless you're family and friends visiting a care home resident. Members of the emergency services also excluded, person providing emergency assistance, urgent maintenance work, people visiting service users who are dying or experiencing bereavement, and any person under the age of 18. And so the requirement to be vaccinated does apply to anyone with the exception of the exemptions and exceptions listed above. In terms of dates, I think the key things to factor in are 22nd of July is when this came into law and when the grace period started. The 16th of September is the last date on which people can get their first dose of vaccination, so that they would then be fully vaccinated by the time the regulations come into force. And of course, that date of the 11th of November again is when the regulations actually come into force. And Gemma, if you wouldn't mind, could you turn the slide now? And I'll cover briefly what the guidance, the operational guidance says. So in the slide that you can see is just a summary of the headings of the different chapters that are covered. And what I will do now very briefly is just to talk a little bit more about some of the most important areas of the guidance. And we have decided to kind of focus on some of those things because they're very important, but also because a lot of people have asked us questions about those things. So we really wanted to clarify the issues in relation to these where possible. So in terms of evidence, people can use the NHS COVID Pass service in order to demonstrate their vaccination status. And there are three routes for doing that. So there's the NHS app. There is the NHS website, which has a non-app version, but again, it's digital. And there is also the NHS COVID Pass letter. All three routes can be used to demonstrate your vaccination status. But as we've stated in the guidance, your NHS appointment card on its own cannot be used as proof of vaccination status. Medical exemptions are also a very important area of the guidance and the policy and the legislation. So the circumstances in which an exemption may be granted reflects the Green Book advice on immunisation against infectious disease and clinical advice from the Joint Committee on Vaccination and Immunisation. The process for securing a medical exemption will be aligned to the process for certification in relation to domestic events and exemptions from isolation for confirmed contacts and travel. And so at this stage, it is likely that people who think they should have an exemption from the requirement to be vaccinated will be asked to contact an application helpline in the first instance, and that helpline will help to decide whether or not their request for exemption is legitimate. There is still a need for us to work through exactly how that process will work, and we're aiming to publish detailed guidance on exactly what that will be as soon as possible, because we do understand that it is very important that we get that information out to people as soon as we can. The other thing I should say is it's important for managers to do a risk assessment for the people who think that they think may be exempt from vaccination, and they can put measures in place to help reduce the risk around that. For example, in relation to PPE, or perhaps a change of the duties that they're asked to perform within the care home setting. In terms of recording vaccination or exemption status, the registered person, who's almost always the care home manager, should keep a record of the vaccination or exemption status of staff members and the date that the status was last checked. The vaccination or exemption status of those entering the care home, unless exempt, and the date that the status was last checked. Individuals entering a care home only need to demonstrate their vaccination status on the first occasion that they enter or register, and the registered person should record the status of the care homes on the care home's local system, for example, IT, paper file, etc. The registered person will be able to share these records with CQC to demonstrate that they have checked third-party medical exemptions. And so Alison, who's our next speaker, will I think cover a little bit more detail on that particular process. The last thing I will cover before I do hand over to Alison is about employment practice, because that's something that has been really important to a lot of people, and we know that there are a lot of questions about that. So I think the first thing to say is that care home managers should engage with people who are affected, and their workers in particular, as early as possible about the new regulations to give them the best chance of being able to comply with them appropriately. Where a member of staff is not vaccinated and cannot provide evidence that they have an exemption, the care option should explore all options, and that includes redeployment to alternative role where vaccination or medical exemption is not required. And so that would be a role that would have to take place outside of the care home setting. Where people cannot or do not want to comply with the regulations, care home managers will need to consider whether or not they have to replace those members of staff. Where staff are away from work, for example, on maternity leave, sabbatical or long-term sick leave, care home managers should contact those people and consider any issues relating to a return to work. Care homes might also need to consider the possibility of paid or unpaid leave for staff, and that might be appropriate in the case where a worker has started to has had their first dose of vaccination, but has perhaps not completed their full course by the 11th of November deadline. And it also may apply where there are delays to obtaining evidence on medical exemption. The last thing to just flag is that some care homes, having existed all of the options above, may have to consider dismissing employees. So I think at that point I will pass over to Alison, and I'm sure we'll cover some of the issues that I've highlighted there in more detail in the Q&A. Alison.
Thanks very much, Martin. So what I'm going to do is spend just a couple of minutes talking you through CQC's approach to the implementation of these regulations. And I think we can all agree that it's extremely important to protect people living in care homes and the staff working with them from the risks associated with COVID-19 infection and also from long COVID, But we are very, very conscious of the impact of implementing these regulations on staff in care homes and registered managers in particular. And with this in mind, CQC is trying to keep things as easy and simple as humanly possible. So today I've got 3 key messages for you. The first is that you, the registered managers and providers, know your service better than anyone else. So we aren't going to be prescriptive about the systems and processes you put in place to meet these new regulations. We want to support and enable you to comply with the new regulations in the way that will work best for you and for your teams. So my strong advice to you would be to tackle this almost as a risk assessment process. Talk to your team and to regular visiting professionals, decide how you're going to make this work in practice, keep a record of your discussion and review any actions that you're taking regularly, making changes as necessary. So I'm going to talk briefly about the approach that we're going to take at registration with ongoing monitoring and inspection, and finally with any enforcement action. So the second key point that I want to make is that we will be using our normal processes to monitor compliance with the new regulation. We're not building anything new, special or standalone. So at the point of registration, and that's for both new service applications and those to vary conditions, we'll be asking about the systems and processes the registered person, the provider or the manager has in place to monitor the vaccination status of staff deployed to work in the care home. And I think it's worthwhile just restating again that this regulation applies to services that are providing the CQC regulated activity of accommodation for persons who require nursing or personal care. Not supported living services, because they're just personal care. It's accommodation for persons who require nursing or personal care. But it also follows that people who apply to be registered manager in a care home will need to be either vaccinated or exempt. So as part of our ongoing monitoring, we'll be asking, how are you assured that those you employ and deploy within your service have met the vaccination requirements? And when we inspect, we'll be assessing how the measures you put in place are working and meeting the regulations. And again, just to say again, we won't be prescriptive about the format of the records you keep to show that you've checked people's vaccination status. The department's guidance makes it lovely and clear that you don't need to keep a copy of the evidence you've seen, just a record to confirm that you've seen that evidence. So it may be that you want to keep a more detailed record, for example, of the evidence you've seen for your own employed or deployed staff. And that could be as simple as the information that's on the NHS app, which just shows brand date of vaccinations. But equally for visiting professionals, you might think, actually, do you know, all I need to do is just put an extra column in the visitor log to tick to say that we've seen it. Similarly, we don't expect you to record the reason for medical exemption, just simply to record that the person has one. And now when it comes to enforcement action, although we could technically take criminal action in the form of fixed penalty notices or prosecution, we think this would happen only in a very, very, very rare cases. And even so, it would be more likely to form part of wider concerns about the service. We're going to be much more likely to use our civil enforcement powers, that's requirement notices, warning notices or conditions. The way the regulation is worded means that actually compliance with it is pretty binary. Either you're meeting it or you aren't. And this is really where my third point comes in. If we identify a breach of regulation, yes, there'll be a breach of regulation, but we'll be reasonable and proportionate in the action that we take as a response to that breach using our normal enforcement and judgment frameworks. So if, for example, we find that a provider's in breach of the regulation, we'll look at things at the round. So if there is potentially a short-term tension between deploying staff who've been vaccinated against having sufficient staff to provide safe care and treatment, and there's a nice risk assessment and a risk mitigation plan, then we aren't likely to go down a heavy enforcement line. It's much more likely to fall somewhere around the lower end of our actions. Now, I'm happy to pick up some questions towards the end of the webinar, but that's all that I've got to say for the moment. So I'll hand back. Thank you.
And I think that's over to me now. So hello, everybody. Jim Thomas here from Skills for Care. So as part of this program, one of the things that we've been doing very, very carefully is to think about all of the workforce support that we already have that may be of use to you in terms of supporting you and your staff through this process, and also to begin to think about what other kinds of support might be required from a workforce perspective. So on the Skills for Care website, you will find that we've pulled together a one-stop place for you to find the existing guidance around the implementation of mandatory vaccination. We've also put in place a document on frequently asked questions that have come to us, or where we have looked at the guidance and thought about some of the questions that you may need answering from that. And we've begun to collect some case examples of how organisations are approaching mandatory vaccination. We've published a link to one so far, and we're looking to pull together others. One of the things that I learned from looking at how organisations are approaching this with their workforce is that the most important thing is open and honest, straightforward conversations with people all the way along the line, and where you can put the right support in place and the right learning in place to help your staff to understand the importance of vaccination. And we think that's a really key element of working with your staff, is helping them to think through why they might wish to be vaccinated, what the challenges are for them, and helping them to find the information to make the decisions that they need to make in relation to mandatory vaccination. So as I said, the first page links you to existing guidance. If we go to the second slide, please. So what you will also find on the web page is we pulled together all of the resources that can help you. Firstly, with workforce planning. Having a workforce planning is a really important part of your program of work to help you to think through the kinds of things that you need to be looking at in terms of your local population, and where you may be able to get hold of the right staff for you in the kind of service that you're looking in. We've got guidance that we've had for a while that has been developed in partnership with a whole range of employers around the country around attracting and recruiting the right staff, and also retaining your staff. So some of the things that very successful organisations have done to improve the retention of staff in their particular organisation or service. We think a piece of guidance that we've developed in partnership with NHS employers over a number of years, called People Performance Management, will be really important to you here, because what that does is it helps you, particularly where you may not have regular access to support from a human resources advisor. It will help you to think through and to look at all of the different aspects of people performance management. It gives you an overview of some of the legal requirements that you need to take account of, and helps you to look at different ways in which you can supervise and manage your staff, not only to get the best out of them, but also to help them to be thinking about the decisions that they need to make around mandatory vaccination. Our resources on well-being are another important thing for you to look at, and what that resource does is it gives you a series of drop-down menus so you can find the right well-being resources for your particular staff, whether it's around mental health issues, emotional issues, physical issues, in all sorts of different environments. Workforce productivity, we think, is a really important part of looking at what you do in this, and certainly what we found through our work with employers around workforce productivity is that the three things that really help people to work and continue to work in a particular environment is how good the learning and development is that they have access to within work time, how well they are supervised, and the culture of your organisation in terms of how you support people within your organisation and make them feel that they are confident and capable in everything that they do. Particularly for local authorities, there's a whole range of resources around how to commission and plan your workforce as well. Finally, we've teamed up with ACAS, and we're working very closely with ACAS. ACAS is an independent body that has a particular role in relation to resolution of disputes, and we've teamed up with them to help get some really good clarity around employment rights, best practice and policies, and resolving workforce conflict. So the final element is that within our localities, we are making sure that we can be there to support you across partnerships, in working with local government and other colleagues in order to be able to look at particular workforce issues in relation to this in different parts of the country. You can also email or phone us, and if we do not have the answer to hand, we will make sure that we've got HR advice for you that we can then share more broadly with everybody. So please do get in touch and tell us about your concerns, and we will look to find answers for you. Thank you very much.
Thank you very much, Jim, and also thank you to Martin and Alison for your really informative summary presentation. I think that concludes the part of the webinar which was about getting the scene setting piece out. We're now going to move to the question and answer session. And first of all, may I say thank you very much for everyone who's submitted sort of questions either through the Eventbrite link or indeed live whilst Martin, Alison and Jim were speaking. We will do our best to answer as many questions as possible, but there is quite a large volume. I think we sold about 3,000 tickets, so there were questions coming through, and I think we are nearly 1,600 attendees today. So let me try to get through some of the questions. I may group them together where I think that makes sense, so that you get a bit less toing and froing among the people answering. So I guess the first couple of questions, which I may direct to Eamon, are about, so how does vaccinating staff protect service users if vaccinated people can still catch, carry and transmit the virus? And another one around the sort of the vaccination bit being about, why do relatives not need to be double vaccinated? So can I ask maybe Eamon to come in on that point?
Yeah, thanks, Claire. So these are very helpful questions and talk in some way to some of the complex issues that we're trying to manage and balancing infection control risks against other benefits from enabling activities such as visiting. On the specific point around the risk that staff, even if they're vaccinated, can transmit infection, certainly this is true, and it's why we have been concerned to ensure that vaccination alone is not the only protection or mitigation against infection. But having said that, we know that firstly, vaccines are highly effective at preventing infection in the first instance, particularly after 2 doses. And with either of the current widely used vaccines, Pfizer or AstraZeneca, we have vaccine effectiveness against infection up to 90%. We know that therefore people who are protected against infection are not going to transmit infection. But even if people become infected while they have been vaccinated, we know that the risk of transmission of infection is much lower. That's because vaccinated people, even if they become infected, are likely to have a far lower viral load and also a lower, shorter duration of infection. And there is increasing evidence coming out about the protection offered by vaccination against what we call secondary transmission. So a recent household transmission study which PHE has produced, looking at data from England, found that household contacts of cases vaccinated with a single dose had between 30 to 50% reduced risk of becoming a confirmed case of COVID-19. And there is evolving knowledge in this area, but the direction of travel of that information is that vaccination both protects people against primary infection, but also against transmission of infection. So it's an evolving picture, and we are continuing to review the science. But there are two important points in summary, which is one, we are right to be concerned that vaccination alone is not proof against infection, but that two, we know it is a major factor in modifying both the risk of infection and the risk of transmitting infection. And therefore, it's incredibly important when we're thinking about vulnerable people receiving care that they have the best possible protection we can offer by having staff looking after them vaccinated. On the related question about, well, why are we not asking relatives or visitors to come in to care homes to be vaccinated? Well, of course, we are, as Public Health England, encouraging everyone who's eligible for vaccination to be vaccinated. This is a general point that we're making to all members of our community, because we believe that in terms of protection of all, this is the best way for us to offer public health interventions at a population level. But we also recognise that people coming in to provide, to visit loved ones in care settings, that they have a benefit to bring to those loved ones. And we don't want to put up barriers against visiting that we believe we can effectively manage. So having said that, we actively encourage everyone to be vaccinated who's eligible, and encourage everyone who's coming into care homes as a visitor to be vaccinated. And we've seen, generally speaking, high levels of compliance with that encouragement. We haven't banned people who aren't vaccinated from visiting care homes because we need to balance some of the benefits that visiting brings against the risk, and we manage down the risk of incursion of infection through visiting by testing people before they visit, adherence to PPE and other infection prevention and control measures. And we have seen a very high level of compliance in the main among people visiting care homes. What we have done, though, is in the latest guidance, which was published just yesterday, reminded people that those who are defined as essential caregivers and who perform a role often analogous to staff are strongly encouraged to be double vaccinated, because we recognise that they are having a particularly close relationship with the people they're providing care for, and they're following the same advice that staff are following in terms of testing and PPE and IPC measures. So we encourage people to take up the offer of vaccination and to be doubly vaccinated. But of course, they are not employees of a care setting. They don't have the same statutory duty of care that many of us who provide clinical care to our patients and people we look after and care for have. But we are encouraging this as strongly public health advice that will enable us to continue to have more visiting by more people more of the time, to do that safely, and to allow the benefits visiting brings to all to be safely enjoyed. Thanks.
Thank you, Eamon. That was really, really helpful. I guess the next one, maybe I'll turn to Martin for it. This is really about either the regs or the guidance, and whether we are planning to update them to reflect developments such as one-off vaccinations or indeed boosters. So Martin, can I come to you for that, please?
Yeah, thank you very much, Claire. So on the point of one-off or single-dose vaccinations, the way the regulations have been written is that the requirement applies to a full course of a vaccination. So a single-dose vaccination, as long as it has been approved by the MHRA, is part of the scope and part of the requirement. In terms of booster vaccinations, they are not part of these current set of regulations. We need to understand more about what the booster vaccination programme will be in order to then make a decision about whether and how we might extend these regulations to incorporate boosters. So at this point in time, the regulations do not, but we will need to come back to that at a future point.
Thanks, Martin. I think the next one that have come in might be for Alison, actually. This is about how we define the threshold of a care home. So is that sort of up to the provider to define that, or is it something that, you know, you at CQC or us in the DHSC should be defining?
Thanks, Claire. Yeah, really, really good question. I think what we need to do is reflect that the regulation is quite specific in that it applies to people who are entering a care home. But we all know that care homes come in very, very many different sizes, shapes, layers, layouts, etc. So you as the registered persons actually know what will work best in your service and for your service. So, you know, for example, if you're a service that maybe shares your site with a coffee shop, some form of community facility that that then sort of leads on to the care home bit behind, then perhaps it would make sense that actually the community, the front bit of the service, isn't classed as your threshold, but the door through which people have to enter to get into the care home bit is that threshold. But really it's up to you to decide what works best in your setting. And if you'd like to contact us for advice, that's absolutely fine. But again, bear in mind, you know your service far, far better than we do. So thanks, back to you there, Claire.
Thank you, Alison. There's a few questions that have come in around vaccination and sort of deadlines. So maybe I'll turn to Martin for those ones. Martin, the first one is around what's the position if a staff member decides to take the vaccination nearing the set deadline date and therefore the date of administration exceeds what is currently in the regulation? What flex is there?
So, I mean, the requirement is that once we get to the 11th of November, you do need to either have a full course of COVID vaccination or a legitimate medical exemption from vaccination in order to continue to work in that setting. So in the event that someone has perhaps started and had their first dose of the vaccination but not their second dose, then I think it would be for the care home manager to consider whether it's possible to provide paid or unpaid leave to that member of staff, because it won't be compliant with the law for that person to be working in that care home setting until they've had their second COVID vaccination, assuming it's a 2-course vaccination.
Okay, thanks, Martin. Again, around a similar theme. So what happens if an employee totally refused to have the COVID vaccination? What's the position? Can they work in a care home after the 16th of September, which is the sort of the deadline for workers to have their first vaccination? And what's happening in between the 16th of September and up to the 11th of November?
Yeah, that's. I think it's really helpful to clarify this point, Claire, because there are a few dates that people need to understand. And so the significance of the 16th of September date is just that you will need to have had your first dose, assuming 8 weeks between the first and the second dose, in order to then be compliant by the 11th of November when the regulations come into force in full. So there is no restriction around people working in a care home after the 16th of September. The restriction comes into force on the 11th of November. It's just that in order to get to be comfortably getting to a position of being fully vaccinated, if it's a 2-dose course, then you would want to have had your first vaccination by the 16th of September.
Thanks. Another question that relates more specifically to colleagues who are on maternity leave. So do the deadlines for vaccination set out in the regulation still apply for those colleagues, or are they like extended on the basis that, you know, an individual would have said they were accepting to be fully vaccinated before they return to duties following the end of their maternity leave? Again to you, Martin.
Yeah, thanks. And so I think it's important to just be absolutely clear here that the 11th of November is an absolute cut-off point for people. It is, and that applies to people who are on sabbatical, people who are on maternity leave, who are coming back, people who are away from work for other reasons. In order to work in a care home setting, you have to, by the 11th of November, either be able to demonstrate you've had a full course of your vaccinations, or you have a medical exemption, or you're one of the exceptions that I listed at the very start of the webinar. So, for example, attending emergency services, performing their duty because there's a serious incident in the care home. If you can't meet any of those requirements, then you or any of those conditions, then you do need to be vaccinated. And so for people who are working in, who are, for example, on maternity leave or away from work, it's really important for care home managers to be able to have conversations with those people as early as possible to make plans for those people to come back into the workplace. But we have to understand that the key requirement for that person, whatever their circumstances are, is that they, in order to be coming back into the care home after the 11th of November, they have to be had a full course of vaccination or have an exemption.
Thanks, Martin. Just moving on a little bit more specifically about what's the options for members of staff that may actually refuse to get vaccinated. So maybe a couple of, if you don't mind taking them together. So what can you do if a staff member refuses to get vaccinated? And then sort of a sub to that would be, can a member of staff change their role rather than, you know, having to leave their current job in the care home?
Yeah, thanks, Claire. So I think we've said that it's important for care homes to explore all options, and so that those options may include redeploying a member of staff, but that redeployment would need to be to somewhere outside of the care home premises itself. So we understand that there will probably be fairly limited scope for doing that, because most of the roles that are part of care homes will take place within the care home premises, and therefore those people will be subject to this requirement. But where it is possible to consider work outside of the care home premises itself, perhaps in a head office, for example, then it is completely legitimate and would be a sensible thing for people to do, to try and see if those members of staff can work elsewhere.
Thanks, Martin. Another one for you, sorry about that. What about if a member of staff give a sort of a non-clinical reasons for refusing to have the vaccine, and they want to challenge the sort of the position they're in particular if they are about to be dismissed? Where do sort of employers and providers stand on that? Can they keep staff on after the 11th of November whilst there are maybe a dispute ongoing and these member of staff are not vaccinated?
Yeah, no, I think again, we come back to the point that the regulations here are just very, very clear that you need to have your full course of vaccination or have a certified exemption from vaccination. And so we understand that there are going to be a whole range of reasons why people might choose not to be vaccinated or not be opposed to undertaking the vaccination themselves. But those aren't legitimate reasons for people to have an exemption unless they're part of the proper medical exemption process. And so I should add to that, we did, as part of our public consultation, consider quite a wide range of views on kind of the reasons why people might be reluctant to be vaccinated. And some of those will obviously vary, and there are a wide range of them, and they include religious beliefs and various other objections that people may have. but we took the view as a government that the public health priority of protecting vulnerable residents in these particular settings was so significant and high that we needed to make the requirement broad. And so we've been very clear about the requirement and the fact that there are very few exemptions from that.
Thanks, Martin. I mean, the next question is a little bit more generic, but I know that's something that's on top of people's mind, and it might be that a couple of you want to pitch in on that. It's about, you know, so how are providers supposed to manage safe staffing levels, knowing that, you know, the regulations are coming into force? So Martin, you're very welcome to come in, but if Alison or Jim want to also add on to that, just say.
Yeah, so I'm happy to start off, Claire, and then perhaps Alison or Jim could come in. I mean, there's a general position is that care homes should have contingency plans anyway to maintain safe staffing levels, and where possible, we would expect registered people, the registered manager, to take reasonable steps to cover any staff shortfalls in the short term through the use of bank or agency staff. Where this isn't possible, it's really important that care homes should flag the issue to local authorities, and it's also really important that they make CQC aware of that issue as well. But I'm happy to hand over to Alison and Jim to provide a bit further information.
Thanks, Martin, and I agree absolutely with that response. Thank you. I think one of the key things to point out, though, is that actually the regulation is very binary. If staff are being deployed to work in the care service and they haven't been vaccinated, then that service, whatever the reason, will be in breach of the regulation. And where we've got some latitude for discretion, as I said before, is around the action that we would take in relation to that. So if the service has done everything that they possibly can to try and find vaccinated staff to fill these staffing shortfalls, but they haven't managed to do that, then it is unlikely that we would take sort of enforcement action. You know, we're likely to go along the lower side of enforcement action, which would be perhaps a requirement notice or a warning notice. We certainly wouldn't be doing anything more draconian than that, but they would be in breach of regulation because there's no way that the regulation allows us to get around that.
And just to add to that, Alison, Skills for Care has published a guide to safe staffing levels that really details the CQC links into that and puts alongside that guidance and advice for you in relation to that, and also puts within that a range of case examples of how different social care organisations have looked at safe staffing levels. So I can put that into the chat for people if you want to download that and have a look at that as well.
Thank you for that. We've had quite a few questions around the exemptions sort of theme. So if I may, I'd like to pick up a few of those to make sure that everybody's got the clarity there. One of the first one we had was about how do staff provide employers stroke providers with the proof of exemption, and where can they access that? And I think, Martin, I think you might have said something about that when you did your presentation, but if you don't mind just going over it so that we are all clear, that would be really great, please.
Yeah, happy to. Thanks, Claire. So the process for individuals who think they should have an exemption from this requirement is that they will be asked to contact an application helpline in the first instance, and that helpline will help to determine with some clinical support what decisions will be taken in relation to the request for an exemption. that process is still being developed and refined, and so we need to provide further information to people as soon as possible in order to clarify exactly how people will engage with it. And we understand that it needs to happen as soon as possible, because people will want to be seeking and securing those exemptions very quickly. So we'll be working very hard to get out further information on that as soon as possible.
Thanks, Martin. And Alison, sorry to bring you in just on that one. Again, I think you did mention it when you did your presentation, but as far as what CQC would be looking for during inspection in that space, could you just remind us all about what you would be looking for proof of exemption, please?
Absolutely, Claire. And again, really important to say that we aren't going to be asking to see confidential personal information. All we're going to be asking to see, your registered provider or the person that they delegate will need to see the evidence of exemption. All we need to see is something that says, I have seen evidence of exemption. Thanks, Claire.
Thanks, Alison. Another one to sort of unpack a bit more. What does that mean for a member of staff who has secured a medical exemption? So will they be able to undertake any personal care task? And if they do, does that mean they require additional protection whilst working? So maybe going to Martin for that one.
Yeah, and I'm happy to answer that, and perhaps Eamon might want to come in on it as well. Brilliant. From a public health perspective. So I think the important point to make is that the first point is that the regulations do mean that staff members who are exempt are still able to undertake personal care tasks. But it's also important for care home managers to undertake risk assessments around those members of staff and whether or not they might want to offer them different duties, or perhaps ask them to undertake extra protective measures in order to counterbalance the fact that they haven't been vaccinated because they aren't able to be. But Eamon, do you want to come in on that as well?
Yeah, thanks, Martin. So it's certainly the case that we would prefer, from a public health perspective, that people who, for whatever reasons, legitimate reasons, were not able to undertake vaccination, that such individuals ideally do not work providing close personal care to vulnerable people. But we recognise that this is often a balance of risks, and we will certainly expect to have some exceptional circumstances where people may have a case such as a person is providing particular care, that there's relationships there, that people with complex needs, including dementia, find it difficult to relate to some people and form relationships, etc. So we understand those are balance of risks. But we will certainly need to ensure that all measures to protect people from transmission of infection through unvaccinated staff providing care are applied. That includes the current rigorous staff testing protocols, the ideal situation that anyone receiving care should be vaccinated anyway, and other measures, including a dynamic risk assessment. If we see evidence that such instances are large in number and or associated with transmission events, then we would certainly want to keep that under close review. But the general principle that we're applying here is that people who provide close personal care to vulnerable individuals are unfortunately at risk of transmitting infection to those people with consequences. And we need to make sure that we minimize that risk by ensuring they are vaccinated. And if they're not able to be vaccinated, ideally, we should look at ways of using their skills in a different way other than direct personal care. But as many of us on this call are clinicians, we understand that these situations are complex. Obviously, we need to take account of individual circumstances, but the principle is clear, and that is the direction that we should be going in applying the policy, I would suggest.
Thanks. There is one thing I'd like us to go back to, if it's okay. It's about application in relation to pregnant care home staff, because I know there's been a lot of questions and debate around that. So could we clarify if there is any sort of exemption or grace period for pregnant care home staff, please? Again, Martin and Emily, if you want to add any public health angle, that would be fantastic as well.
Yeah, so just to say, in terms of an additional or separate grace period for pregnant members of staff, we don't have that. The regulations come into force on the 11th of November. In order for people to continue working within the care home setting after that date, they will need to have double vaccination or an exemption from vaccination. As part of the exemptions process, and perhaps Eamon will talk a bit more about this in a moment, pregnancy-related medical complications would constitute potentially a reason for an exemption from vaccination, and so there may be scope for where pregnancies associated with other medical complications for those pregnant women to have an exemption from vaccination. But for pregnancy in the main, there is not a separate exemption overall, and there is not an extended grace period for people who are affected by that. Eamon, did you want to come in?
Yeah, thanks, Martin. So just to add to what you've said, pregnancy per se is not a contraindication to receiving COVID vaccine. And in fact, people will be aware that there's been a recent health promotion campaign to advocate that women who are pregnant do come forward for vaccination, and the JCVI has advised that women who are pregnant should be offered vaccination at the same time as non-pregnant women based on their age and clinical risk groups, and at this stage that refers to almost the entire population. So it is very clear that women who are pregnant should be considered as eligible for vaccination unless they are not, by which we mean if they also take a box listed in the list of contraindications that may make vaccination either temporarily unsuitable or not suitable. But it is important to recognise that there is evolving clinical understanding on this. It's why the regulations and the policy advice have linked to the Green Book, which is often referred to as the Bible for immunisation for general practitioners and public health doctors. So we do know that we are evolving our understanding about this vaccine, but certainly from the knowledge and scientific evidence we have at this moment in time, we would and do encourage pregnant women to consider vaccination, and unless they have a specific contraindication, they wouldn't be excluded. I think this is very positive because it says two things. One is that to the whole population, that pregnancy should not be seen as a contraindication to vaccination. And two, it supports and enables women who are pregnant to continue to work if they wish to do so, and can do so if they wish to take up the offer of vaccination. So I think this supports our ability to keep people in the workforce rather than somehow creating an artificial barrier for women who choose to have a pregnancy to somehow be excluded from work on a misunderstanding about their eligibility for vaccination. So an important public health message that pregnancy is not a contraindication to vaccination, and in fact women who are pregnant are encouraged to be vaccinated, and your midwife or GP or other healthcare professionals will support you in understanding if vaccine is contraindicated based on other medical conditions, either emergent during pregnancy or pre-existing.
We're running a little bit out of time, so I was just going to suggest we take maybe a couple of questions in relation to potential extension of our regulation. So we know the current one applied to CQC registered care home. So is it likely that this will be extended to other areas of social care would be one thing. And the other sort of extension to that question is what about, NHS settings? So Martin, may I come to you for these two questions and then I will wrap up?
Yeah, Thank you very much, Claire. So I think the first point on that is that one of the most, the strongest and most resounding messages of our first consultation was, why are we only looking at care homes? Why are we not also focusing on parts of the NHS and other parts of adult social care? So we took on board that message and we considered how we might address it. And as a result of that, we've announced that there will be a further consultation around vaccination as a condition of deployment and the extension of that policy across the NHS and across social care. We're intending to launch that consultation in the coming weeks, although I can't be more precise about the exact date of that at this point in time. I should also say that that consultation will cover both COVID-19 and also flu. So that there's a very kind of big set of issues to kind of discuss with various workforces, with the public, with the country as a whole, and so we'll be launching that in due course and considering all the range of views and then coming to a decision after that consultation. I should say at this stage also there was it should be pointed out, if it's not already clear, that any members of the NHS workforce who do work inside a care home at this point in time are covered by these regulations, as are other visiting professionals, whether they are kind of hairdressers or plumbers or irrespective pretty much of their profession, they are covered by these regulations in care homes. But we will be launching that wider consultation in the next few weeks to cover the wider social care workforce and also the NHS.
This may just be the last question I think we have time for today. I know some questions were answered live during the chat, and I just wanted to say that we'll aim, of course, to share a version of today's webinar with attendees, and all the questions you feed in we will consider and aim to sort of process internally as well. Can I just say a massive thank you to the presenters and colleagues who help with the question and answer, and also the team behind the scene who've been trying to make sure the technology worked. My apologies for muting myself repeatedly. Thank you so much for all of you to attend, and I think this concludes today's webinar. Thank you.